Endometriosis is a horrible condition. It's thought to affect around 10% of people who have periods, and it can cause painful periods, heavy periods. It can cause pain in the pelvic region, which is not even related to the periods. It can also cause blood in poop, blood in urine. It can cause painful sex, and we don't understand it well enough to have a cause for it or a treatment that will cure it. But there are treatments available. It's a stepwise chart essentially, where we start with things like ibuprofen because it helps to reduce prostaglandins at a uterine level and hopefully reduces pain associated with endometriosis. It's also an anti-inflammatory. Then we can move on to things like birth control and hormonal contraceptives, which can hopefully just stop periods completely and therefore reduce the pain and hopefully either reduce the growths or reduce the rate of growth of the endometriosis. And then if we find that these treatments aren't working, or if there's any signs of kind of infiltrative endometriosis going into the bowels or other pelvic organs, then at that point we would refer to the gynecologist, ideally to an endometriosis specialist who can do an operation called a laparoscopy, which allows them to visualize inside your abdominal cavity. And ideally we want them to excise, to expertly cut out the endometriotic lesions. But that doesn't mean that it will either resolve the symptoms completely. It doesn't mean that the endometriosis won't grow back. And there's always a chance that even with a specialist doing the operation, they may not even see endometriosis. Now, I've had people in my comments saying that a hysterectomy can cure it. A hysterectomy will probably do nothing for endometriosis because the whole point of endometriosis is that it's tissue similar to the lining of the womb growing outside of the womb. So that means it's growing in the fallopian tubes, in the ovaries, anywhere in the pelvis. Some people even report it in the thoracic cavity or the brain. So just removing the womb isn't going to do anything.